Before we get started, a quick heads up for our US listeners. We're giving away a copy of Dr. Seth Berkley's new book, Fair Doses, an insider story of the pandemic and a global fight for vaccine equity. To enter, just send an email to thepublichealthinsight@gmail.com with book giveaway in the subject line. That's it. Entries close on November 26th, and we'll reach out to the winner of the contest on November 27th. Full details are in the show notes. Good luck.
If you look at the COVID pandemic, it cost the world somewhere north of $12 trillion. And so the idea that we're going to cut millions here and millions there to stop that system that was there, it was extraordinary what was done during COVID. So we delivered, I told you, 2 billion doses. And so during that period, developing country systems delivered 3 times the number of doses they had ever delivered before. Hello, everyone. I'm Dr. Seth Berkley. I'm an infectious disease epidemiologist and former CEO of Gavi, the Vaccine Alliance, and author of the book Fair Doses. And you're listening to the Public Health Insight podcast. I hope you enjoy it.
You're listening to the Public Health Insight podcast, your go-to space for all things public health and global health. From the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Lines are drawn on maps, but viruses don't care. In the last few years, the world watched as science moved at breakneck speed, delivering vaccines that shaped the course of a pandemic. But behind every breakthrough, there's a story of who gets access, who gets left waiting, and what it really takes to protect billions of people. This episode unpacks the global machinery of vaccine equity, the politics, the science, and the human stakes, revealing how the next chapter in public health will be written not just in labs, but in the choices that we make together. I want to use this opportunity, Dr. Berkley, to also zoom out of all of this too, because I think we can get lost in it. There's a lot of discourse about what vaccines are, what they aren't. There's vaccinations being used as a political tool. There's sort of even the polarization of vaccination status too. Like someone's vaccination status tells you about who they are as a person or who they aren't. So it gets a little bit messy.
But it does.
Right. So it's a bit messy now, and I wanted to zoom out of all this. And you've stated it several times about the significance of vaccines as a health intervention. So I want to zoom all the way back out and talk about the importance of vaccines in the first place and why we even need them, just so we can demystify that it's not sort of a random thing that people want to make money from. You mentioned that there's private players that in theory profit from this. A lot of the times what gets lost in conversations is why vaccinations are important.
Yeah. So Gordon, that's a great question.
Yeah. So can let's live in that space for a bit.
Let's go all the way back.
Yeah.
And I just wrote a piece for Science about this. And I took us all the way back to the UK hundreds of years ago. And why did I do that? The actual death rate was about 350 per 1,000 children.
350 per 1,000.
35% of the kids died. And they died of these infectious diseases that had evolutionarily grown with humans. And one of the worst of these was smallpox, which, as you know, is the one disease that's been a human disease that's been eradicated. And that was through a vaccine. But the point is that it really has been, it's been sanitation and clean water and some other things. But the really big change has been the control of all these infectious diseases. And the reason this is so important to keep in mind, and by the way, just to give you an example, today in the U.S., about 5 of 1,000, so 0.5% kids die.
Right.
And then if you look at the best in the world in places like Iceland, it's like 0.9 of 1,000. So you think we went from 350 down to 0.9. This is an amazing change. And that's what's led to the increase in life expectancies, et cetera. The problem is if you live in a developing country and you have these diseases still around, auntie down the street will have lost a nephew, or you will see a baby that is blind or deaf because of an infection they got. And so for them, it's real. These diseases are real. In wealthy countries, you just assume if you have a child, that child is going to live and is going to be fine. And the reason, one of the big reasons, is the control of these infectious diseases. And so that's really the challenge that we have right now, because when the whole anti-vaccine movement, vaccine hesitancy, has existed since the first smallpox vaccine. In fact, right after the smallpox vaccine, there were these amazing woodcuts of people with cows' horns growing out of their heads and others, because the original vaccine was isolated from cows. And so it's always been a problem. But now it's gotten to be much more pervasive, and it's also become highly politicized. And of course, the internet has allowed it to move at the speed of light. There are different bots that are putting out misinformation, disinformation, and all of this is happening at the same time that if you're the average person, you say, I'd like to be organic, I'd like to be healthy. Why am I injecting these things in my kid? You know, the kid's going to maybe have a fever or have pain in the arm. Do I really need to do this? I've never seen any of these diseases. Are they really that bad? And then there's misinformation out there. And so it's really a challenge, because you don't want to scare people to death, but all you have to do is go work in an infectious disease hospital in these countries, see all these diseases, and you realize then how far we've come. And frankly, my own view is, where do we want to go? We want to make it 0 preventable deaths in kids. This is where we should be. There will still be genetic abnormalities, other things like that, but we want to get that type of protection out there for everybody everywhere.
In a world where information moves faster than any virus, the battle for public trust is relentless. Misinformation isn't just noise. It's a force that shapes real-world outcomes, from vaccine hesitancy to outbreaks of diseases we thought we'd once beaten. But this isn't just about individual choice. Herd immunity is a collective shield, protecting the most vulnerable amongst us. As coverage drops, diseases like measles and polio, they threaten to return, reminding us that borders are meaningless to viruses. The fight isn't just against pathogens. It's against complacency, disinformation, and the illusion that we're safe just because we can't see the threat.
In an ideal world, you're fully protected from disease. But sometimes the vaccines don't take. And sometimes you have children who have, let's say, a cancer diagnosis and their immune systems aren't working well. And so the way you protect those children who can't get protection and those kids who maybe not had a vaccine take is by getting rid of those diseases, because then they're not exposed to those diseases. If you have a situation where, and that's what, by the way, herd immunity is. Herd immunity means you vaccinate enough of the herd so that the disease can't transmit anymore among the herd, and therefore even those who aren't protected by vaccines or can't be protected get protection from disease. And so that's where you want to go. Now, there was a lot of discussion during COVID about herd immunity and, if only we got to a certain level, but it turns out because the virus is always mutating, you can't get that type of herd immunity, because then the new virus comes and it spreads through the population, and then the new virus. Luckily, the vaccine is protected against severe disease and death, but it didn't protect against infection. But for example, measles, which is the most easy to spread organism we know of, if you were to go into a doctor's office with measles, go out 4 hours later, some kid comes in that office, they can catch it just being in that space. That's how contagious it is. So for measles, you need to have very high coverage, around 95%, to get herd immunity. And once you have that, then measles disappears. And so right now, the U.S., for example, has eliminated measles. The indigenous transmission of measles was eliminated, but there have been some recently big outbreaks, not just in the U.S., and Canada, the U.K., many places. And it's likely that the U.S. may lose that indigenous thing because there'll be enough susceptible people to keep the transmission going. And that threatens all kids because some of them may not be able to get protection, et cetera.
Right. Something sparked as you were mentioning that too. Is there a danger also in if there's more transmissibility with measles, for example, because of lower vaccine coverage, there's sort of the immediate problem of more people getting infected and getting sick and then further transmitting it. But also, does that give the virus more opportunities to mutate and evolve as well and render the actual vaccines that we currently use for measles that are very, very, very effective? Does it over time risk waning immunity for that vaccine as well? Is that a realistic concern that we have in the
That
scientific
is a
community?
realistic story for vaccines in general. It turns out that measles, the vaccine has worked now for 65, so it's about 60 years it's been there. And the virus has not changed dramatically. And therefore, it's probably unlikely that that's going to lead to that problem. But that is certainly a problem for other viruses. And it's one of the reasons we want to get really good protection and try to eliminate these diseases as much as we can, because you don't want lots of this viral movement going on. And it's also why you have to care about the rest of the world, because let's just go back to the measles example. Let's just say that we've eliminated measles in the US and in Canada and other countries. If you have lots of measles going on all over the world and 1 billion people travel outside of their countries a year, at some point somebody will come and reintroduce it. And I remember when a few years ago there was an outbreak in Disney World in the US, and they were able to track who the person was that transmitted it. People thought, oh, it's going to be some illegal alien, or it's going to be some person from a developing country. Turned out to be a Swiss tourist, who was ultimately the person passing it. So the point is that you can't make any assumptions. You can't create walls. You can't stop people from moving. As long as infectious diseases exist, they will continue to spread. So the best thing you can do is vaccinate the whole world and bring down these diseases, ultimately trying to stop it. So the next disease we're working on, I said smallpox was the only human disease. Rinderpest was a biblical plague in animals. That also was completely eradicated. So that doesn't exist in animals anymore. And the third one that people are working on right now is polio, which used to cause 350,000 cases of paralysis a year. I mean, terrible thing. And people scared all around the world. Today, there's only wild-type polio in Afghanistan and Pakistan, so we're getting close to eradication, but it requires keeping very high coverage. And of course, as you have this anti-vaccine movement and people shift away, then you have outbreaks, and we've seen outbreaks occur in religious communities and other places because they've been able to get exemptions. So this is a constant battle against evolution that we're doing to try to control infectious diseases.
If you're enjoying this conversation and want to go even deeper, don't miss out on your chance to win a copy of Fair Doses by Dr. Seth Berkley, the guest who I'm interviewing right now. In order to participate, just send an email to thepublichealthinsight@gmail.com with book giveaway in the subject line. US listeners only. Entries close on November 26th and will notify the winner on November 27th. Details are in the show notes. As we wind down, I wanted to hearken down into something you said there about anti-vaccine movement, distrust in science. You mentioned a little bit before about vaccine nationalism. And we're also contending with the reemergence of vaccine preventable diseases across the board in many ways. And yet, it seems to some anyway that the global response is to reduce funding for a lot of these vaccination programs, but probably public health, global health in general, but largely impacting immunization programs across the globe. What's your reaction to how these things are sort of unfolding?
It's terrible, and it doesn't make any sense. I mean, if you look at the COVID pandemic, it cost the world somewhere north of $12 trillion. And so the idea that we're going to cut millions here and millions there to stop that system that was there. Now, it was extraordinary what was done during COVID. So we delivered, I told you, 2 billion doses. And so during that period, developing country systems delivered 3 times the number of doses they had ever delivered before. And they delivered them to elderly populations and people with comorbidities and other healthcare workers, et cetera. And they delivered the vaccines to kids. It dropped a little bit, but they were able to do that. That was because there was a system, because they were trained people, because they had cold chain facilities, because they had, knew how to use syringes and do all of this. And the idea that you wouldn't want to continue to support that when that is the system to both detect a potential new outbreak, but also to react against it. And from my perspective, the single most important thing we can do, we went back to, I told you about 90%
Yes.
of people who have access to the routine system. That last 10% is where you've got now more than 50% of the child mortality, and those people are living in poverty. So
Wow.
what we should be doing is extending that out and trying to reach every last one of those communities. That would be the right thing to do now to
Mhm.
get prepared for the evolution inevitability of other outbreaks. So
Mm.
I think it's really foolish to be doing that. Now, of course, I am a vaccine advocate and I understand that. But
Right.
when you look at the prevention of disease, for every dollar you spend on vaccines, you get a $54 benefit. I mean, if we could get that return in Wall Street,
I would take it
that
right
would be
now.
an
I'd quit my job right
amazing
now.
vibe. Yeah, but
There's a paradox at the heart of global health. Just as vaccines prove their worth, skepticism and budget cuts are on the rise. The numbers are stark. Every dollar invested in vaccines returns 54. Yet the last mile is always the hardest. The children who remain unprotected are the ones most at risk, and the systems built to reach them are under threat. The race to develop new vaccines to respond to the next pandemic in 100 days is a race we can't afford to lose. But it's a race that demands investment, vision, and the courage to act before the crisis hits.
so the point is you've got this amazing set of tools. We've made them affordable. We've made them
Mm.
available. The challenge now is to continue that process because we're at this moment where we're going to have, we have two vaccines against cancer. We're going to have more. We're going to have vaccines against chronic diseases and new, infectious diseases. And science is at this amazing moment. And what are we doing?
Mm.
We're both stopping funding universities. We're
Right,
killing
right.
funding medical research. We're stopping funding development aid. And this does not seem very smart. I mean, recent
Mm.
example would be the US government has pulled back from mRNA vaccines. And, you can argue whether mRNA are the best vaccines or not, but that's not the point. The point is they are the single fastest way to make a vaccine. Now, when the next pandemic occurs, maybe it'll have a 1.5 or 2% mortality like COVID did, but maybe it'll have a 20, 30, 40, 50% mortality. You have a really severe pandemic, then every minute counts in terms of moving towards a better product. And there is nothing that we know of right now that can produce. We had the vaccine made in 42 days and
Mhm.
first injected for testing in 63 days.
Right,
Nothing can
right,
go at that speed.
right.
And that was before it was licensed and well studied. And so there's been an effort to try to create a 100-day mission. The idea would be that when a new pandemic occurs, to have a vaccine ready within 100 days.
Mm.
Let me give you an example why that would make such a difference. In COVID, what we know is in 100 days, there were something like 2.5, 3 million infections that we knew of. By 327 days, when we actually got the vaccine, which was a world record, there were already 70 million infections. And so the issue there is if you can move it forward, you might be able to damp down or even stop the spread of a pandemic. So this is what the world should be investing in. We spend a gazillion dollars on defense, but these pathogens are more likely to cause these types of massive death, episodes or disease episodes than our defense issues. So we need to think of it that way and prepare the world.
I wanted to get your thoughts on the WHO pandemic treaty. So May 2025, lots of conversations there to finalize the treaty. Some countries were on board, some countries maybe not so much. I know you have some thoughts on maybe what you felt they got right and maybe some things that you are a little bit concerned about the WHO pandemic treaty not capturing, which could be problematic should another pandemic arise. Can you talk about that a little bit?
Yeah, I mean, I think one of the challenges, of course, is trying to get 200 governments to agree on anything is difficult to
200
do.
of anything to agree on anything is hard
Yes,
enough.
exactly. But I think of all things, preparing for future pandemics should be very high on the list. And the big differences really related to the issue of fairness and equity. So the argument was, look, if companies are going to make vaccines, and if the diseases come from developing countries, then developing countries should get the benefits financially and access wise. And there is a fairness argument there that is important. But at the same time, one also needs to balance it with companies. If companies are the way to make vaccines, they have to make money. Now, if the government is willing to fund everything, that's another way to go. But we've made a decision globally that we want private companies to make vaccines. And so Gavi's job has been to put incentives in place for them to make them more inexpensively so poor countries can have access to them. But these were some of the arguments and trade-offs that went on. But of course, it was a real blow to the pandemic treaty when the US government said we're not going to sign it and we're not going to be involved with it. And in fact, we're going to withdraw from the WHO. Why is that important? WHO certainly has challenges and needs reform, but what we need to do is lean in and fix the things that don't work. Pulling away from it isn't the right thing to do because it, of course, is the one place where people can come together and discuss these things and try to move forward. And they create global standards. So the vaccines that we bought during the pandemic all had WHO pre-qualification. That meant that they inspected them and said, yes, these meet kind of a global standard that's important. And that's critical for small countries that don't have really good regulatory systems to know. So there are many useful things that WHO does that frankly, if WHO didn't exist, we'd have to recreate an organization like WHO to be able to do this. So I think that's really been quite challenging. And I would hope in the future that what we'll do is work on trying to constructively work on the reforms that are there and not just walk away from it.
If there's one lesson from the last pandemic, it's this. Preparation isn't just about stockpiling supplies. It's about building the systems that can move at the speed of the crisis, funding, manufacturing, and distributing vaccines before the headlines hit. It's about making sure that no region is left behind, that vaccine production isn't just concentrated in just a few countries, and that the world acts together, not as a collection of isolated interests. I wanted to finish with a thought experiment. So, okay. Dr. Berkley of September 2025, armed with his book, Fair Doses, goes back in time to January 2020 and is able to have that foresight of how things would unfold if it played out the way it did. With that knowledge, how do you think it might have unfolded differently? Like with you being able to play that leadership role with that knowledge from what happened in the future?
I mean, there were a few things. One is having the ability to take risk and do it clearly. So because that would allow you then to say, we've already pre-negotiated this, we know, and the board, the donors, the countries, everybody knows what's there. That would be one really big thing. A second thing would be having what we call 0-day money available. And so we actually set up a facility called the 0-day facility that has about $500 million in it. A number of other agencies have agreed to put together a mechanism to allow another about $2 billion that could be raised initially. But why is that important? Because then you can begin to negotiate for access to vaccines, but also to begin to prepare for technology transfers. And if you had enough money, you wouldn't do it in one company. You would do it in different companies in different geographic areas, learning from what happened before. And so those would be two important lessons learned. We also had to, because these vaccines were produced in record time and companies couldn't get insurance, we had to put together insurance programs, no-fault compensation and liability insurance. And again, we had to negotiate all that. We could have that there ahead of time. And so these are different things that we could do at the beginning to make us better prepared going forward. But as I said, some of the other things that are important are trying to make sure the health systems extend all the way out to the periphery, and that's something to do in peacetime. And also increasing vaccine manufacturing in places that don't have it. Africa, which has a large percentage of the population, produces less than 0.1% of the global vaccines. And that's something that needs to be worked on. It's not so easy to just snap your finger and have vaccines produced there. But what would have to happen is to create the facilities, the people, the regulatory systems, but also the marketplace, such that in peacetime, those facilities can make vaccines that are profitable so that they're there and ready to go in wartime, if I want to call it that, or pandemic time. So they've got those facilities set up. So these are all things that could be done as part of preparations for the next one. Or if we had been able to do it there, it would make a difference. The one that is the hardest, that I don't know the solution for, is the vaccine nationalism approach. And the reason that's so complicated is because it is the job of every political leader to protect their populations and every person to protect their family. So that's human nature. And the challenge is not to say, don't do that. It's to say, let's make enough so that it's rapidly available in large volumes. And let's let every country take care of their high-risk groups immediately. But then let's do other high-risk groups in other countries as the best way to control a pandemic.
Okay, wise words. So, Dr. Berkley, your book, Fair Doses, An Insider Story of the Pandemic and the Global Fight for Vaccine Equity. What do you want listeners of this podcast to take away from what to expect reading your book?
Well, I think, three different parts. One, the history of vaccine equity, how we got there. We've touched on many of those pieces, but there's lots of interesting stories in there. Second would be a little bit about, my own career and how I got there, and just for people that are interested in that. And then the third is a little bit more of a deep dive in what happened during the pandemic, really what happened. And I tried to be completely honest, at least in my point of view, and I talked about who were the good players and the bad players and what worked and what didn't and what we learned in real time. And there's lots of lessons there, I think, that are important going forward. I hope people enjoy it. It's written for a general audience. It's not written in a heavy technical type piece, although there are some, reading and notes for people that want to delve deeper.
True equity means protecting high-risk groups everywhere, not just at home. The next pandemic will test what we've learned and whether we're willing to put those lessons into action. Vaccines are more than just a scientific achievement. They're a measure of our collective will to protect each other. The choices we make now about funding, trust, and cooperation will echo into the future. The fight for vaccine equity is ongoing, but with the right lessons and the resolve to act, we can build a world where protection isn't just a privilege, but a promise. Before we go, remember, you can win a copy of Fair Doses by Dr. Seth Berkley. Just email thepublichealthinsight@gmail.com with book giveaway in the subject line. You have to be a U.S. resident in order to participate. Enter by November 26th, and we'll notify and announce the winner on November 27th. All the info that you need, in case you forgot what I said, is in the show notes. Don't miss out. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.